What I want to do now is answer a question, do injections for heel pain wear off? And the short answer is yes. So let's talk about what we're doing here. When we're giving an injection for heel pain, we're normally giving an injection of a type of cortisone underneath the plantar fascial ligament in order to reduce inflammation. So the condition we primarily give these injections for is plantar fasciitis. Plantar fasciitis, itis means inflammation. But if you look at the literature on plantar fasciitis, in general, the itis portion, the inflammatory portion, only lasts for about the first month. Then you get into a situation where the tissue starts to degrade a little bit. You get some degeneration of that tissue. That's a condition called plantar fasciosis. So most of the studies on injections for this problem show that they will give short-term relief, usually from 3 weeks to 3 months. But after that, the effect does wear off. Injections work better early on. So when it's mostly inflammatory, the injection can actually make a real difference in getting you over that inflammatory response. And then you can do all the other available treatments such as stretching and strengthening and orthotics and proper shoes to prevent the problem from coming back. But if it's been more than a month or so, and there's been some degeneration of the tissue and you now have plantar fasciosis, the injection is much, much less likely to be effective for any appreciable amount of time. So I know this is pretty involved, but what I would suggest now is if you've had heel injections and they haven't lasted very long, go to our website, do a search for plantar fasciitis, and read our guide to plantar fasciitis. It goes over in detail all the available treatments, including injections, when they do tend to work, when they don't work, and what the current literature tells us about when we should use them and when we should not use them.